Diabetic neuropathy is a commonly encountered complication of diabetes. The smallest nerves, predominantly in the feet, are damaged when this condition occurs. In a worst-case scenario, wounds can also occur and fail to heal properly. This is called diabetic foot syndrome. Wounds are aggravated if a circulatory disorder already exists. The nerve fibers that enable sensation are primarily located in the upper layers of the skin. This is where cold, heat, pain, pressure, and touch are perceived and transmitted to the brain. In diabetic neuropathy, the outer nerves, which include the sensory nerves and motor nerves, are often damaged. The sensation of pain is distorted. Minor injuries go unnoticed and can develop into more major wounds. So as to identify areas that need care and treatment early on, and to prevent the progression of foot disease, diabetes patients must examine their feet themselves on a daily basis. Regular foot care is advisable. A regular foot examination by the GP is recommended at least once a year.
Welcome back, dear viewers. Now we reached another foot disease, which is diabetic foot, and we will have Mrs. K. Scarsbrook-Can, podiatry team leader from the Sman Diabetes Institute. She will answer our questions about diabetic foot and what complication may occur for its patient in case they didn't take the symptoms seriously. Pleasure to have you, Mrs. K, with us today in our show.
Many thanks for inviting me. I'm thrilled to have this opportunity to be able to talk about this very important but often very neglected aspect of diabetes foot care.
Thank you so much, Mrs. K, for your time. We are really happy to have you tonight with us over the phone call. So we have many questions for you, and we would like to start with, we would like to know what are the most common foot problems with diabetes?
Well, diabetes can affect the nerves and the blood supply to the feet, which can increase the risk of developing a foot ulceration or a wound on the foot. Some of the most common foot problems in people with diabetes, although these are not exclusive to those who have diabetes, are fungal infection of the feet and dry skin.
So,
fungal infection commonly occurs between the toes, but it can occur anywhere on the skin of the feet, and it can also occur in the nails. And the symptoms of fungal infection in the feet are skin changes, often maceration, where the skin appears white and spongy, redness of the skin, blistering, skin peeling, small blisters, and sometimes itching. And in the nails, fungal infection can cause thickening, discoloration, and crumbling.
So Mrs. K, what about the signs and symptoms of diabetic foot problems?
Well, unfortunately, if you have damage to the nerves or the blood supply in your feet, you may not be aware of this, as there are not usually any signs or symptoms. Some of the signs to look out for if you do have a foot problem are colour change, so a change in the regular colour of your feet, swelling, especially if it's in one leg, a break in the skin or a wound, a difference in temperature between the feet, if one foot's warmer than the other or one foot's cooler than the other, or pain. But if there's damage to the nerve, pain may be absent, even if there is a foot problem.
So Mrs. K, we would like to know what are the most common causes diabetic foot? Well,
foot ulceration is the most common if you have the following. So nerve damage to the feet,
Okay.
a reduced blood supply in the feet, deformity in the feet, or kidney failure.
Okay.
So, Mrs. K, what are the complications of diabetic food problems?
Unfortunately, if you do get a foot ulceration, it can get much worse. And if a foot ulceration fails to heal, it can result in amputation of the toe, the leg, or the foot. And the 5-year mortality for someone who's had a diabetic foot ulcer is about the same as for many common cancers.
So, Mrs. K, it seems that it's a really serious problem, and hopefully there is an effective way to treat the diabetic foot. Could you tell us about the treatment?
Yeah, sure. So, the prognosis of diabetic foot ulcers is usually better if treatment is sought early. So the sooner you see a medical professional when you have a foot problem, the better.
Okay.
Treatment really depends on the underlying cause. So if you see a medical professional, they will complete some tests to check the blood flow and the nerve supply to your feet.
Okay.
If there's a problem with the blood flow, they will send you to a vascular consultant for some tests on the circulation.
Okay.
If there's infection, they'll usually take a swab or tissue sample and prescribe antibiotics.
Okay, so in the end, Mrs. K, how can diabetic patients prevent themselves reaching this level of pain?
Some of the key things that people with diabetes can do to prevent future foot problems are actually the most important thing is probably control of blood glucose. Along with this, they should control the cholesterol, blood pressure, and as smokers, stopping smoking is very important. They should have their feet checked by a healthcare professional to identify any problems to their blood supply or nerves at least once a year, because as I said before, you're probably not aware if you have problems to the blood supply or the nerves. And very importantly, they should check their own feet every day for changes. And looking for those things I described before: redness, heat, swelling, pain. And if problems are identified, to seek medical care quickly.
Okay. So
And
go ahead.
they should never ever walk barefoot, even in the house, to make sure their feet are protected.
Yeah. So, Mrs. K, we would like to know if this is common here in Kuwait, since we have a really high rate of diabetes in Kuwait.
Yeah, it is common. About in a diabetic lifetime, there's around a 19 to 35% chance of acquiring a diabetic foot ulcer, which is really quite high.
Oh, okay.
Oh, wow. So, Mrs. K, I know that there is a gym in the diabetes center, the Smart Diabetes Centers, right?
Correct. Yeah.
So the patient who suffer from diabetic food, they exercise there, and what are the advices you gave them?
So with regards to the gym and exercise, this is more geared towards prevention of the problems of diabetes. So if you exercise and have a healthy lifestyle, that can help reduce your blood sugar levels, and that can help prevent problems.
Right.
So we're looking at really prevention.
Great. Well, thank you so much for your time with us, Mrs. K.
No, thank you so much for inviting me.
Thank you.